and really great crew of people here today. And so I'll go ahead and get things started. It looks like we've got plenty of folks here. I'd like to begin today's virtual conversation with an acknowledgement and recognition that the land I stand on, and where I believe most of you are joining us from, is the traditional unsurrendered territory of the Abenaki people, one of 5 Wabanaki nations who've had a continual and enduring presence here in Vermont since time immemorial. In Abenaki, Waban is the white flickering light in the sky, and Aki is the word for land or the earth. So the Wabanaki are the people of the Dawnland. We acknowledge their ancestors, their history, and their presence, which continues to this day. So thanks again, everybody. It looks like we've got 75 or more folks here today. A few items of housekeeping I'd like to go over before we get into the meat of the conversation. I have my colleagues, Catherine Crawley, who's our Director of Communications, and Michelle Bailey, who's our Senior Programs Manager, behind the scenes, helping us with chat and making sure everything works smoothly. So I just want to give thanks to them. I also want to make sure you know that we've got live captioning for this event. This event is being live captioned by White Coat Captioning. And to view the captions during the event, you click on the closed caption button at the bottom of your Zoom screen and choose Show Subtitles. You may also view the full page text of the captions by clicking on a link that we're just about to post in the chat function of the webinar. And Catherine, I'd ask you to repost that when you have a chance in that chat thread, and folks can use that. Also wanted to note that this is being recorded and it is being streamed right now on YouTube Live. And wanted to mention, I think we're all like becoming experts in video conferencing, so excuse me if this is remedial, but I wanted to just make the distinction between the Q&A and the chat function. Today, our hour with Patsy Kelso is going to be like 90% Q&A, and we're going to be reading from the questions that you all put in that Q&A box, in addition to the great ones that many of you posed when you registered, which we've kind of synthesized and talked through a little bit. So use that Q&A function for questions that you would like to see addressed in this conversation. We'll do our best to get to as many as we can. And then the chat function, let's keep that to the introductions. We'll use that for references. If there are resources or links that people want to share, use the chat function for that. What I don't want to have happen is for one of our participants here today to post a question in chat and then I miss it because I'm not able to look at 3 things at once. So we want to get to as many people as possible. Yeah, so this conversation is a part of our continuing efforts at the Vermont Arts Council and through our Vermont Creative Network Creative Sector group to provide support, response, and recovery support to the creative sector field. We've done that in a couple of ways, 4 primary ways. The first wave was the immediate response work. As many of you know, we've worked with the Vermont Humanities Council and with some private funders to distribute, it'll be more than $750,000 to arts organizations and to artists directly as a first wave of rapid response in the face of this crisis. That chapter is closing and we're shifting our focus towards some of the other roles, including helping the creative sector navigate and get access to other economic recovery resources that are being offered by the state and the federal government. We are working on advocacy for the creative sector to ensure that our sector is getting the support that we'll need to thrive when this is over. And then 4th, really coordinating and providing access to good information so that our sector can reopen responsibly. And that's really the focus of today's conversation with Patsy Kelso, is from a public health perspective, how do we make the very best choices we can to keep our staff safe and to keep our public and our audiences safe. So with that said, I do want to mention two pieces, and I'm just seeing, we've got that stream text link up there. I wanted to mention a survey that we have sent out via email and is on our website, and we will put it in the chat. We are in trying to figure out and offer the most useful programming possible to the sector. We put together a really short survey from the Vermont Creative Network, and would love for you to take a minute to fill it out. I know we're all feeling a little maybe over-surveyed by this point, but this one's short, and this will inform our future offerings. And then I wanted to mention some breaking news, which I think definitely informs and will shape our conversation today. A lot of folks have been curious about when galleries and museums are going to be given the green light to open, and we have heard that in all likelihood on Friday, the Agency of Commerce and Community Development will be giving the green light to museums, galleries, and libraries to reopen. For galleries and museums, they will be reopening under the guidance given to retail outlets right now. What we expect will be the announcement will be that folks can reopen starting June 1st. So I know we had a lot of questions in the initial registration about what the timeline was for some of those things. So I wanted to just start things off by letting you know that is the latest breaking news. So with that, I would like to turn it over to Dr. Patsy Kelso, who is our state epidemiologist. Patsy, you met with us on April 20th last. That kind of feels like 2 years ago in some ways, right? I want to thank you so much for carving out time for us. I can't imagine what the demands on your time look like right now, but this is really valuable. Thank you so much. I was hoping to just open things up with you by inviting you to just share the latest, what we know, and I'd love to hear your reflections since our last conversation. If there's some good news and what the continuing challenges are for you, and then we'll get right into the Q&A. So welcome, Patsy. Thank you very much.
Great, thanks for having me. If you could share those slides, I'll review some of our data quickly for folks, just to give a sense of where we are, where we've been. And apologize in advance if you hear my dog. She may bark at some point. Okay. So I only have 4 slides. I'm not going to take up a lot of your time with this, but I thought it would be helpful to see where we've been and where we are. This slide is our epi curve, our epidemic curve of our cases to date. So back on March 7th was our first case, and then our second one was March 11th. And then, we've had, it's a little distorted because we've got that orange line, which is the cumulative cases as they've increased over time. But in the next slides, we'll focus in more on those blue bars because they are a little bit more dramatic than they appear there. But you can perceive even on this slide that we did have a sort of peak time of transmission in Vermont from late March into early April. And then since then, our daily numbers of new cases have been thankfully low. So we go the next one. So this is the blue bars without that orange line kind of compressing them. And just again, showing the peak of transmission in Vermont and where we've been the last several weeks, which is much better news. The light blue bars are the cases, and the darker ones, the small numbers, typically 1, 2, or 3 a day, or 0, are the deaths and the dates that those occurred. So this, really gives a good picture of where we are with the pandemic in Vermont. And next slide focuses in on the testing. So the blue bars are the same blue bars we've been looking at. They're tiny on the bottom. The reddish and grayish bars are the numbers of tests that we've performed each day. And the red and gray bars are negative tests, and the blue ones are the ones that were positive. And then that yellowish line that is a bit harder to see is the percent of all the tests we've done each day, the percent that were positive. And that's one of the indicators. There's many epidemiologic and other indicators that we're looking at on a daily basis to assess where we are. One of them is the number of lab tests that we're doing. And as you can see in the last couple of weeks, the number of total tests done each day has been increased. We've been trying to ramp up testing, get more people tested. You may have heard about the pop-up test sites that we're offering around the state. So we are increasing testing. Our numbers of positive tests remain low, and therefore the percent of the total number of tests each day that's positive has also been low. We sort of set a trigger for when we would start to get nervous as we restart Vermont and open things back up. And we think that if we get to about 6% positive, that would be concerning again. So we'll keep a close eye on that. And then the last slide is just what we call syndromic surveillance data. The dark blue line is influenza-like illness. And as you might expect, as the winter wound down slowly this year, we started to see less and less flu illness presenting at emergency departments. And around that same time, we started to see COVID-19 cases. So these are not confirmed cases of COVID-19 or influenza. They're just when people go to the emergency department, what their chief complaint is. And as you can see over the late winter into April, we were seeing a few percent of people going to the emergency department were complaining of symptoms that might be due to COVID, and that has decreased steadily to where we are now, which is less than 1%. So we're not seeing an awful lot of COVID-like illness. We're not finding a lot of positive cases, and we are in a different place than when I spoke with you last. So that was the end of the data that I was going to present, just to give you a picture of where we've been and where we are. And as Amy said, the expectation is to announce on Friday that galleries and museums and libraries can reopen. Also expected for Friday is an announcement from the governor that the gathering size, the group size can increase from 10, where it currently is, to 25. So we expect that to be effective Monday, June 1st as well. Do you want me, I have a couple more updates. I mentioned we've been focused on increasing our testing because we feel like without testing people, we won't have a really good sense of what's out there. If people are symptomatic or even asymptomatic, but not seeking healthcare and not getting tested, then we won't necessarily know. So we've been increasing our testing. We're also increasing our contact tracing, which is whenever we do have a positive case, we interview that person, find out who their close contacts were when they were potentially infectious, and then we reach out to those close contacts and advise them that they need to stay in quarantine for 14 days and watch for symptoms. In the last week or so, we stood up a new app that we're using. It was developed by a group led by a former Vermont Health Commissioner, Dr. Paul Jarris. The app is called Sarah Alert, and we'll be voluntarily enrolling people in Sarah Alert. If they're a case, they can be enrolled in Sarah Alert, and it will send them a message once a day by the method they choose, whether it's an email, a text, or a phone call. Check in, see how they're doing with their symptoms, see if their symptoms have resolved, see if they need any help with things like groceries or essentials for daily living. And then as they recover, we'll be able to document that. And then for the close contacts, we'll also enroll them in Sarah Alert. They'll get a message every day as well by whatever method they choose. And the message will ask them whether they have any symptoms due to COVID-19. It'll list symptoms and have them say yes or no. If they say yes, they'll get a prompt that they should contact their healthcare provider. And then we'll also, I think, get a message, and we can reach out to them and make sure that they get linked up to a healthcare provider or a testing site or whatever is appropriate. So that's a new development that will enhance our ability to be in touch with people every day, whether they're a case or a contact of a case, and make sure we have a good handle on what's going on in Vermont. I think at this point, that was really my updates. I'll try and run through some of the questions that were submitted in advance, if that's okay, or Amy, do you want to moderate that?
That's perfect. If there's some burning questions you're itching to get at,
Okay.
go for it. And I'll monitor. I'll just let folks know. Please go ahead and submit. You're welcome to submit questions in the Q&A function, and then you're also welcome to vote up questions that you want the answer to, and that will help us prioritize.
Okay, so I promise we'll get to those, but I know there were some submitted in advance. So one of them was the timeline for gathering sizes. And as I said, we expect that the governor will announce that for June 1st, it can increase to 25 people from 10. Reopening dates, Amy has talked about that for some of you, so that's good news. Best practices for museums and art venues and other types of settings. Those are still really what we've been saying all along. General things like outdoor settings are safer than indoor settings just because there's more air circulation. Definitely social distancing is still gonna remain important. Mask use is still gonna remain important. Hand washing and hand sanitizers being available is still important. Trying to think what the general guidance that's on the health department website, as well as the ACCD website, the general reopening guidance for everybody. So take a look there. And I know that the link to the ACCD website is in the chat.
I think actually that was at the, I think we should maybe repost that, Catherine, if you're able to, because it's that work safe page, right, Patsy, that gives all the guidelines for any kind of like a museum or gallery that's looking to reopen. There's a long list of policies and procedures and employee training that they need to get in place before they can think about reopening their doors. And I'm sure a lot of you have already been paying close attention to that, but that page is important.
Yeah, that page is really useful. It's accd.vermont.gov, and it's the work safe update.
Oh, there it is, Catherine. Thank you. Yeah.
At the top of the page is the mandatory health and safety requirements for all businesses and government and other operations. So there's a list of bulleted items that apply to everybody. And then underneath that are more specific guidelines for certain things like coming in from out of state. And then below that, it gets into different sectors. And as Amy said, when galleries and museums are allowed to reopen, it will be under the retail operations sector, right?
That's my understanding. And libraries are kind of parallel to that guidance, but they have their own specific section right now of some guidance around curbside service, that sort of thing.
So I believe this page will also be updated further after the governor's press conference today, which I think is still going on. But if you check this page tomorrow or later today, it should have additional updates, because I think the last updates were from a prior press conference. So keep an eye on that page, it's super helpful. The outlook for fall and the possibility of a second wave, it's a great question. Everybody wishes they knew the answer to that. We think, the best experts, not me, the best experts like Dr. Fauci and others think that, we will still continue to see COVID transmission. It may decline over the warmer summer months like other respiratory viruses do, and then pick back up in the fall and winter. So that's kind of what we expect, but whether it will be a big resurgence, bigger than what we saw in March, or whether it will be sort of ticked up a notch, but still relatively low level, it's hard to say. A lot of that is really going to have to do with a few key factors. One being, are people still social distancing, staying out of large gatherings, and wearing cloth facial coverings in public? That's the best we can do as far as community mitigation levels to slow the spread, whether it's spreading at low levels like it is now, or whether there's a bit of a resurgence or a big resurgence in the fall. So those things are going to remain key. In addition, we do think there's a good chance there will be a vaccine. I think the fall is the very earliest we would see one. It's probably more likely to be in the winter time, if they do, find one that's safe and effective, which it looks like things are progressing well, but there's no guarantee until they do more clinical trials and make sure it actually works and is safe. So, but a vaccine could really be a game changer if it's an effective vaccine and we're able to get it to a large segment of the population. It'll create enough immunity that it will help slow down transmission and then give protection to the most vulnerable and others. So keeping a close eye on that, but no real clue yet when that might be or whether it will happen.
Patsy, I'm noticing there were several questions in advance, and then I'm seeing a popular question in the thread that are about, for summer camps. So many of our arts organizations offer summer camps for children, and of course that was part of the earlier turn of the spigot to be allowable, and so there's quite a few questions around that. Specifically, Doreen Crafts asking, is it your recommendation for children attending summer camps? Is it your recommendation that all children are masked, and is it mandatory?
Yeah, I'm just trying to find, I'm on the ACCD website trying to find the summer camp information, and I'm not seeing it after I said it was so helpful.
My colleague was sharing some just this morning that I believe is on the Department of Children and Families website.
Oh, that could be.
Let me, so we will get that piece up in the chat.
Let's see, I see lodging and campgrounds. Well, I'm not finding it, so I'll tell you what I can. I think masks are certainly going to be recommended, but the governor is hesitant to require them. He's placing it on all of us to heed the best public health advice and protect ourselves and others. And so, yes, I think masks are going to be a strong recommendation, but to my knowledge, they're not going to be a requirement. Hand hygiene is going to be really important. And if there's no access to running water and soap, then hand sanitizer is a good second option. As far as either vendors or artists coming into a camp setting or children leaving a camp setting to go somewhere, I think that's going to be largely up to the different camps to decide. how they're going to run their operation and what they're going to allow. There may be some guidance on the ACCD or DCF websites, but I think it's also going to be camp dependent. Some camps have mostly Vermont kids. Some have lots of kids from out of state. There's day camps and overnight camps, and I think they're all going to look a little bit different.
Yeah, thank you. And Catherine has posted, it's on the healthvermont.gov website, that your website, where the, and Catherine has just put those into the chat queue. So thank you, including, there's a YouTube link from a safety and guidance for childcare and after school programs that was recorded last week. So that should have some information there.
I've heard about that, but I haven't looked at it yet, so I should do that.
And just another reminder, folks, if you've got a question, use the Q&A function. And if you've got a comment or another reference, use the chat function. Questions posted in the chat are probably doomed to be lost. And I just want to see, I see we've got someone who's raised their hand, and I would invite you to chat or post a question in there so that we can get to you. So a lot of questions. Obviously, a lot of our organizations are have a lot of out-of-state participants and audience members. Typically, we have a lot of our arts and creative sector businesses who are on the borders of our state, where, you know, the Upper Valley, you cross the Connecticut River, or you're in Bennington, you know, those borders are very fluid, and so, or were fluid before this. And so the guidelines around out-of-state visitors, are they still prohibited? Is there a timeline? If you could get into that, there's a lot of particular questions, understandably, about those issues.
Yeah, and we're hearing those same questions. So there is guidance on the WorkSmart ACCD website around cross-state travel and what's allowed or not allowed. Basically, the state is still saying that unless you're an essential worker or a few other things, you can't come into Vermont without quarantining for 14 days. So that really means, you know, what quarantine means is having a place that you can be, and it's not a Vermont lodging establishment, but having a home or a friend's home where you can go, basically stay there, not go to stores, not be out in public for 14 days. And then at that point, if you're still asymptomatic, you'd be released from quarantine. So we are looking, the governor and his team are looking every day at data, including not just Vermont, but what's happening in states around us. And we're looking at things like a 2-hour drive time from the center of Vermont, or a 3-hour drive time, or a 4-hour drive time, and what the case numbers look like in those areas. And really trying to, the governor was just saying at his press conference today that we're working on developing some metrics so we can really assess when we think that the COVID-19 picture in our neighboring states is close enough to what we're seeing in Vermont that we feel like we can allow more travel across state lines, whether it's Vermonters going away and coming back or others coming into Vermont. We're not there yet. The big concern is that our numbers look really pretty good in Vermont right now, but when you look at the states all around us, even though they're trending in the right direction, their case numbers are a lot higher than ours. And so there's a big concern about out-of-state travel introducing more disease into Vermont. So that's where we are right now, looking at it every day. There's a lot of urgency around the sectors of the economy that are impacted by out-of-state travel. And, you know, everybody understands the importance of out-of-state travel to lots of different sectors. So we're looking at it really closely to make the best judgment about when we can open that up.
We have a specific question in this regard from Richard Bailey about whether there's been any consideration given to requiring Vermont ID or driver's license at entranceways to larger public gatherings.
Not that I'm aware of. Again, in the governor's press conference today, a reporter asked something about enforcement of people coming from out of state into Vermont. You know, we're all hearing stories or seeing it ourselves that if you drive around, there are out of state license plates at all kinds of places in Vermont. And did these people really quarantine for 14 days when they got here? And the reality is there's no enforcement. You know, law enforcement isn't going around all those cars and saying, where's the proof that you quarantined? So it's tricky. And to my knowledge, there's no talk of requiring documentation. There is for lodging establishments that are partially open currently. The guidance is that the lodging establishment is allowed to require a driver's license or a signed document from the guest where they attest that they've met the quarantine requirement. But beyond lodging establishments, I haven't seen any discussion of that.
We have a question from Linda Treesh that touches on two issues that I'm seeing raised frequently. So she asks, we have a summer theater camp that normally includes a lot of singing. How much space is required for singing to be safe, indoors and out? And so I just want to lift up, there's a lot of questions about the concerns of singers and instrumentalists and the transmission being very high, and what we know about that. And then the parallel issue in Linda's question is about outdoor versus indoor performances. And there's a couple of other questions in that, around that.
Yeah, singing is a risk because, believe it or not, we know coughing and sneezing can propel droplets into the air, but clearing your throat, laughing, singing, those types of things can as well. And there's an article about, I think it's a church choir. I haven't read the article, but I've heard about it. And I think it was a church choir where there was a whole bunch of spread to a lot of people in that environment. So it's tricky. Singing and choirs and potentially playing musical instruments where you're blowing. There's elevated risk there as opposed to other types of activities. To my knowledge, we're not prohibiting music lessons in small groups. I think that will be one of the next evolutions of restarting Vermont, is allowing those types of things. Outdoors is definitely better than indoors where you can do that. And I think mostly it's important just to recognize that that is a higher risk and people need to make decisions about whether they're particularly vulnerable or maybe limiting group size, following the guidance on ACCD website.
Great. I should mention here that I probably should have mentioned it at the beginning that we have, as a part of our response and recovery efforts, we've put together a small team of a creative sector recovery team, we're calling it, folks from many different sectors, subsectors of the creative realm, arts and cultural leaders from all over the state. And we're working with them. One of the things that we're working on in addition to an advocacy focus is a guide of for some other resources around specific reopening questions and specific procedures for folks like choirs and orchestras and different kinds of venues. So that is in draft form right now, and we will have more news on that soon. And I wanted to thank Joe Adler. You put the link in the chat box to that article Patsy was mentioning about the choir outbreak. So thank you for that.
Thank you. I'll check that off my list.
Great. You guys have a lot of really great questions. We have a number of questions. We've got Joseph Watson from Middlebury. I understand that the virus can last longer on solid surfaces like metal door handles than on soft surfaces like cloth theater seats. Can you explain the science behind that?
Yeah, so I can explain a little bit. Viruses, unlike bacteria, viruses need to be inside mammalian cell in order to be alive and reproduce. So if a virus is just in, a drop of spit from when I coughed, and it lands on an upholstered chair or a doorknob, it's not going to stay alive for very long, hours to a few days at the max. Part of what dictates how long it stays alive is the room temperature and the humidity, because you can imagine if that droplet falls into, a sunbeam coming in from the window, it's going to dry it up and desiccate the droplet, and then the virus will probably be no longer viable within a couple of hours. But if it's on a surface that's more conducive to keeping that droplet moist, it's going to live longer. But again, it's days and not hours. And I'm not a virologist, so I can't get much more specific than that. It's mostly common sense when you think about if there are moist droplets, they may still have virus in them. Once it's dried up, that virus isn't going to be alive anymore and able to infect someone who touches it. Having said that, it's a lot easier to clean a doorknob than it is to clean an upholstered theater cushion or something. So time is one factor. If there's time between performances, a couple days, there's probably no cleaning that's required for those types of surfaces. I'm not saying don't clean, but yeah, it's limited by the virus's ability to stay viable inside moist droplets in the environment.
Right. And just a follow-up question, if there's any specific recommendations for touchable exhibits in museums. Sherlock Terry's mentioning that the CDC changed the info on the likelihood of transmission through touch.
Yeah, it's why we've been saying from the beginning that you shouldn't touch your face, because we can touch all the contaminated doorknobs that we want, but if that virus is just on our hands, it's not going to infect us. It's only when we then touch our face or our nose or rub our eye that it gets into a mucous membrane. So, I think it's okay to be touching things in the environment, because we all touch things all the time, whether it's doorknobs or our desktops or an exhibit at a museum. The important thing is don't touch your face, wash your hands frequently, have hand sanitizer around, that kind of thing. So I think certainly if a lot of different people are touching stuff, there's a potential risk of transmission, but we also can't stop touching everything. So reinforcing hand washing and hand sanitizer and not touching your face are useful too.
And it might be appropriate, I'm aware of some museums and libraries that are working on procedures, and there's probably some folks here on this call today who have already started to think about implementing regular, like hourly cleaning schedules, or 2-hour cleaning schedules, something to, all of our folks who are working in museums and galleries and libraries, I think have a tendency to keep things clean anyway, but to really get to systematize a regular cleaning process would be helpful, in addition to the encouragement that our visitors do their own due diligence and wash their hands.
Yeah.
Great. We've got quite a few questions on, live performance possibilities. And I'm going to read this specific one from Claire Dolan. Interested in your thoughts on live performance possibilities. If a venue has ample outdoor space and can seat audience members 6 feet apart, or even set up drive-in viewing, will it be deemed safe for these kinds of events to occur if the total attending audience does not exceed the number permitted for gatherings in general? Can we expect live performances to be something allowed this summer under the circumstances like those described above? And I'll just jump in really quickly to mention that I'm aware of at least 2 organizations in the state that have some plans in place for some drive-in concerts. Catamount Arts and Spruce Peak, I know, and I'm sure there's others working on it.
I think, yes, those types of things are likely going to be permissible if organizations can figure out how to make them work within the constraints they have as far as space and ability to broadcast or project things. But yes, I think we can be creative, making sure we stay within whatever the size limit of gatherings is at the time, whether it's 25 starting Monday and whether later in the summer we hope to be able to increase it further. And then, you know, if the gathering size is 25, you could conceivably have 25 people in one area of a lawn, for example, and then maybe another 25 in another area of the lawn. So yes, we can be creative about thinking about ways to do things, especially outside within the group size. Yeah, does that answer it?
Yeah, that's really helpful. I want to, sorry, bear with me a minute. So some follow-up questions related to timeline for possible events in August and in around Thanksgiving. So we have a question from Sherry about a long-standing arts and crafts festival held in early August for the last 59 years, significant part of our revenue. Should we continue to plan in case it's possible to hold this event? And I'm not sure if it's an indoor or outdoor event, or has it been decided that events in August are not allowed to be held? And I'm guessing that answer might depend on whether it's an indoor or outdoor event.
Well, it partially depends on whether it's indoor or outdoor, but it largely also depends on what the group size is at that time. And we don't honestly know yet what August is going to look like. We only know what June 1st is going to look like. I think it's quite possible that the group size in August is larger than 25, but I honestly don't see it being, 200 or more. I think it's somewhere much closer to 25. So, but it's impossible to say, but I think it's closer to 25 than it is to 200 in August. So it depends on group size. Yeah, unfortunately, that's about all we can say at this point.
A specific question, not about events, but a little bit more specific. Nathaniel's asking, when will testing sites be able to test for antibodies as well as having the virus?
Yeah, that's a great question. The challenge with antibody testing, and the reason we're not rolling it out in Vermont for the pop-up sites or offering the test at our public health lab, is that we don't have enough data about the effectiveness and the accuracy of those tests. There are a bunch of different antibody tests out there. I think there are a dozen or more allowed by the FDA. But I think just this week there was data suggesting that some of those tests are less accurate than we thought. They tend to be qualitative and not quantitative. So they tell you yes or no, you have antibodies. What they don't necessarily distinguish is whether the antibodies they detect are to this specific coronavirus versus other more common coronaviruses, like ones that cause the common cold. So they can't all distinguish between the types of antibodies. And they also don't quantify the amount of antibodies you have. They just say you have it or you don't. And so there's no way to know whether the antibodies that the test might say you have give you enough protection to make you immune, or give you enough protection so that you can't be exposed to the virus and maybe be asymptomatic, but be able to spread it to others. So, it's able to replicate in your nose still. So there's just so much we don't know about the accuracy of the test and what they mean for practical purposes that we're not offering them yet.
Got it. Thank you. That's interesting. So let's see some specific questions here. Going back to the idea of like drive-ins, the drive-in performances, drive-in cinemas, would the 25-person limit still apply if people are in their cars?
Oh, that's a good question. I think so. I think it
Maybe,
would.
but maybe we should follow up and find out, because I do know a lot of people thinking about this sort of thing.
Yeah, but again, I think, you know, if we say you can have 25 in a group, then as long as you distance that group of 25 from another group of 25, you know, you could have potentially multiple groups of 25 as long as the groups were distanced from each other.
And when you say that, I'm envisioning people on their nice picnic blankets on a green in clumps, in separated clumps of 25. But I think what some people are whipping up is like the drive-in movie theater model, where people are staying in their cars. So you're saying that you believe that, you know, if there's 5 cars lined up and there's 5, that's a bad example. There wouldn't be 5 people in the car probably, but that would constitute the public gathering maximum, maybe, or we don't know.
Sorry about the dog. Yeah, for drive-in things, we're encouraging creative things like drive-in types of venues. Cars should be spaced far enough apart that there's 6 feet between the window of one car and the window of the car next to it. That's a for sure. You can have multiple people in the car, but they should ideally be from the same household, you know, because they're close together in that confined space. So you can have 5 people, mom and dad and 3 kids in the same car, but the car should be at least 6 feet from the window of the car next to it. And then your question about how many cars total could you have in one space, I'm honestly not sure if it's limited to the number of the gathering size at the time, or it's a good question.
Well, I'll note that one as something we'll keep an eye on and try and get some further info on. Let's see some other, we've got that. Oh, here's an interesting question on indoor outdoor. So what about, and this is coming from Jen at Circus Smirkus, because they have a lot of tents. Should tents with sides be considered indoor or outdoor?
Yeah, that's essentially an indoor environment because it doesn't allow free air circulation and airflow and exchange of, you know, fresh air. Even if there are doors or windows in the tent, it's still an enclosed space.
Great. You guys have some great questions, and as we're getting to the last 10 minutes, I think I'm just going to do some rapid fire. Some of these are pretty specific. Karen Durfee, we've been thinking of closing for an hour and cleaning our museum at midday and then reopening. Is that necessary or advised?
I don't know that you'd need to close for an hour and do cleaning. If you can work in cleaning, you know, wiping things down, even as people are still there, I would think that's,
so it would kind of be up to them in terms of how they, how their operations. And I think Karen is with Echo. So talk about hands-on stuff everywhere. I could see there might, with it being such a large museum and so many interactives, it might be easier just to shut it down for an hour and clean everything than. Got it.
Yeah, whether you close or not, just frequent wiping down.
Yeah, great. And then let's see, we've got that one. If people test positive for COVID-19 but have no symptoms, how long do they quarantine, and should the rest of the family get tested too?
Great question. It's not a quarantine if you're positive or symptomatic. If you have it, it's called isolation. The CDC guidance is 10 days. If you've tested positive but never had any symptoms, it's 10 days from the date of your test. You have to stay isolated. And then after that, you're still asymptomatic, you can mingle with people again. Whether your family should be tested, they would definitely be considered close contacts, and they could certainly be tested. There's not a strong recommendation that they be tested unless they develop symptoms, but they could be tested even if they didn't have symptoms.
And I think when we were having this conversation on April 20th, the access to testing, that was very different than it is now. So here's a question from Rachel Moore. In your personal opinion, strictly speaking from a medical and human health perspective, would you recommend not opening summer camps, opening a gallery or a building to the public?
I think there's still a lot of things we don't know. We have learned a little bit about this virus and who it impacts most severely and how it's transmitted. And having said all of that, I think at some point we have to restart the economy. At some point we have to get back to something more close to normal. And I think it's okay to take small steps, be measured about it, limit group size, encourage social distancing and masks and hand hygiene. And then, but at some point we have to start opening up again. And so I think it's okay to do all the things we're talking about, but in a very measured way, recognizing that if we start to see changes in the data, we might have to either, take a pause or slow down or, react appropriately.
Matthew Perry asks, excuse me, any news on private residential school groups going off-site to attend classes in the community?
I honestly don't know. I would check the healthvermont.gov information around schools and camps and childcare, because those types of things might be addressed there.
Right. I'm wondering if the Agency of Ed would have produced any guidance on residential schools too. So I'm adding that to the list of follow-up things in addition to drive-ins, right? And then we've got a specific question about public picnic tables. Any policies around public picnic tables?
Well, they should be 6 feet apart for sure.
The tables, not the people at the tables.
They should be spaced so that the end seat on one picnic table is at least 6 feet from the end seat on the other picnic table. So you need to make sure that people are more than 6 feet apart.
Got it. And I would suspect if any of you have these on your sites, and I know a lot of you do, that they're incorporated in your regular cleaning protocols.
Yeah, maybe use some plastic covering on them or something that can be wiped down, because it's hard to wipe down a wood picnic table.
Splinters. Yeah. Will the welcome centers open soon?
Good question. I don't know.
Okay. Deborah Goodwin asks, we offer art classes for both children and adults. We're going to run our summer camps for kids because that's been specifically allowed, but we've canceled our adult classes. What do we know about when that might be possible? And I guess maybe that would fall under the kind of public guideline, the public gatherings numbers. It would be possible as long as you're under 25, right? Or once 25 becomes the rule.
Once we get to 25, yeah. I think that either later today or after Friday's news conference, I think there will be updated information about those types of settings on the ACCD website.
Great. Let's see here. We've got a couple last questions. How can you know if an out-of-state visitor has quarantined for the appropriate amount of days when they come to your site?
You can't. All you can do is ask them. And you can choose whether you're going to ask them and what you're going to do. Have a plan though, what you're going to do if they say yes or if they say no.
Right. And then getting back to testing, in terms of the tests, will access to tests be opened up more this summer to the point where we could ask or require all of our participants of a class or an overnight camp to take a test 14 days in advance of the program start date? Will that be feasible given the amount of tests available?
That's a tricky one because right now we have plenty of tests available, but it's not just the lab capacity to run the tests, it's do we have enough swabs and who's going to collect the samples and who's going to get them to the lab. and who's going to convey results to all the people who were tested. You know, we can't just have Amy calling people to give them their results. Really, that should be a healthcare provider. So it's all of those logistical things that actually pose more of a challenge than do we have enough test kits, because right now we have plenty of test kits. So who's going to order the test, collect the specimen? And we honestly don't have answers to those types of questions right now, even for all the students, tens of thousands of students who are going to be returning to Vermont in the coming weeks and months, and all the employers that are opening back up. So, and the other thing, it's one thing if they had a test before they came to camp or some kind of program, but they'd need to then stay quarantined as well, because if you have a test, but then you're going out to the store and things, you could be exposed after the test.
Right. I think we have time for one last question, and I'm going to take this one up at the top from Sarah Rooker. I struggle with opening my small historical society where just about every volunteer is in their 70s and 80s. They're feeling isolated, not coming in, but how could I safely allow them to volunteer?
It's going to be a personal decision whether, you know, each one of them knows their own health status and underlying health conditions beyond their age, which you probably aren't aware fully of. So it needs to be a personal decision. I would say if you don't have running water and soap, make sure hand sanitizer is available, enforce mask use, limit the number of people there at any one time, those types of things. But we can be strategic about taking, you know, small risks and allowing society to open back up and paying attention to people's mental health as well.
Great. Well, thank you so much, Patsy. This has been so informative, and you're so gracious to allow us to just throw a million questions at you. As far as next steps go, encourage folks again to complete that survey about what our future forums and webinars focus on. I've got some follow-up questions. I'm going to try and dig around a little bit and find out more. And I may, Patsy, shoot you a couple specific questions as they come my way. If folks have other things that they're curious about, that would be, please do let us know. And I'm sure I'm forgetting to say something else in wrap up. ACCD work safety guidance website. Stay tuned for the announcement about art galleries and museums. The Department of Health page is an extremely important resource. The Vermont Arts Council, we've got a COVID-19 section. You can find the latest about what the status of our grant programs are, different resources for arts organizations, resources for artists. We have a whole page devoted to virtual arts experiences. You guys have created amazing virtual experiences in the midst of this, so send those our way and we'll populate that page. And I think that is just about all. I'm so grateful for everyone's time. I think we got to almost every question. I apologize for some of these that we didn't address, but more soon. Thank you, everyone.
Thanks for having me. Stay well.
All right, be well, everyone. Goodbye.